get started. So good morning and thank you for joining us today. My name is Catherine Zambrano Chavez and I'm with Baptist Health System. Joining us today is Michele Patterson, Director of Clinical Services at the Comprehensive Stroke Center at St. Luke's Baptist Hospital. Just a few house rules before we get started. Please keep yourselves muted. We do encourage questions after the presentation. And to do so, we ask that you please use the Q&A box or the chat box to submit your questions. The Baptist Brain and Stroke Network offers comprehensive care for neurological disorders and conditions. Baptist Health System consists of 6 acute care hospitals, which are able to provide interventions and quality treatment for stroke. The comprehensive care services range from emergency intervention, surgical capabilities, rehabilitation, stroke nurse navigation, and stroke support groups. St. Luke's Baptist Hospital was the first comprehensive stroke center in San Antonio, providing the highest level of stroke care available. In 2021, the Baptist Brain and Stroke Network will also add mechanical capable thrombectomy centers located at Northeast Baptist Hospital and Baptist Medical Center. Our dedicated multidisciplinary team of physicians, nurses, therapists, navigators, caregivers, and other healthcare providers are hand-selected by Baptist Health System for their expertise. One of those fine clinicians is with us today. Michele Patterson is the Director of Clinical Services at the Comprehensive Stroke Center at St. Luke's Baptist Hospital. She became the director of the specialized program after spending more than 20 years as the manager of the stroke program at San Antonio-based Methodist Healthcare System. While at Methodist, Ms. Patterson began working as a primary stroke program manager for a large hospital and helped it attain primary stroke certification a year later. Ms. Patterson regularly acts as an industry expert and mentors for nursing staff and students in her community. Thank you, Michele, for joining us. I'm going to hand this off to our medical expert so she can walk us through a brief presentation. Thank you again for your time.
Great, thank you, Kathy. And to all of those that have joined us today, I really want to thank you for letting me have part of your time. I'm really excited to share this information with you because I feel that this information helps us save lives. And so we'll talk about recognizing stroke. We're going to talk about how we recognize stroke fast, but we're also going to talk about stroke prevention and steps that we can take to make stroke not happen in the first place. So we'll go ahead and get started. Let's see. There we go. All right. So Kathy, thank you very much for that wonderful introduction. And so I do want to know a little bit about those of you that have joined us today. So I thought we'd start off with this first discussion question. And so I'd like to know how many of you know someone who have survived a stroke? It could be yourself. It could be someone that you know. So I'll give you a few moments to answer that question. Okay, great. So this does not surprise me. And so we have 100% of our participants today actually know someone who has survived a stroke. And I also, not only in my professional world, but also in my personal world, I also know a stroke survivor. And this does not surprise me. Let's see. There you go, because stroke happens, and it actually happens more than we think. Every 40 seconds, somebody has a stroke, and every 3 minutes, there is a stroke-related death. And so this is a real call to action for us, not only as healthcare providers, but also as family members and friends, and as part of our community as we come together. When we look at every year in the United States, there are 800,000 people who suffer a new or repeat stroke. So we want to prevent these new strokes from happening, and we also want to prevent somebody from having a second stroke as well. So when we talk about stroke, we're talking about your brain or a brain attack, and we'll get into that a little bit more. But first of all, let's just talk about you and your brain. So our brain is everything that makes us who we are. It's how we understand information from our senses. It's our personality. It's everything that we do. So it's responsible for thinking and remembering, understanding, being able to plan and reason, and also being able to problem solve. So very high level things. So our brain is the largest and most complex organ in our body, and it's made up of more than 100 billion nerves. And we kind of need every one of those 100 billion nerves because all parts of our brain must work together in order to keep us functioning properly. So if one part of the brain is affected, then it kind of affects everything else, or one of those key components, whether it's our ability to think or understand, touch, feel, all of those things all begin to come into play. So let's talk a little bit about some fast facts about stroke. So stroke is a brain attack. Many of us are familiar with the term heart attack, but when we're talking about a stroke, we're now talking about your brain. So we refer to that as a brain attack. And I think sometimes we think that a heart attack or a brain attack only happens at certain ages. But a stroke can happen to anyone at any age and at any time. So it really doesn't discriminate. It can affect young, it can affect older individuals, and it can happen at any time to anyone. Every minute when a stroke happens, 2 million brain cells die. So time is very important when we talk about stroke. We'll talk a little bit more about that as well. When we look at leading causes of death, stroke is the 5th leading cause of death in the United States. And when we look at women alone, we see that it is the 4th leading cause of death. And it's also the leading cause of adult disability. So oftentimes individuals may survive the stroke, but they survive that stroke with disability, and then that ends up affecting your quality of life. So we talked a little bit about women. So about 55,000 more women than men have a stroke each year. And African Americans are twice as likely as whites to have a first-time stroke. Now, one of the things that we do know is that 80% of strokes are preventable, and we can do this through lifestyle changes. And so this is our first line of defense, preventing the strokes that occur the first time. And we do have medical options that exist for to treat stroke that can reduce the effects of stroke. And these treatments are time sensitive. And that's why we use the acronym FAST. We want to recognize a stroke fast, and then we want to act fast in response to that. So the types of treatments that we are currently doing, clot busting medication, that's been around since maybe the 1990s. And this is being able to administer a medication that actually dissolves a blood clot that may be interrupting blood flow to your brain. We can do a clot removal intervention, and these started coming around right about 1996 or 1998, where if there is a large clot in a large blood vessel feeding blood to your brain, we can actually go in and remove that blood clot, which is truly amazing. And then we can also give anticoagulant reversal medications. And so this is when you have a stroke that's related to bleeding and you've been taking blood thinner medication, so we can actually reverse the effects of that. So we have a lot of treatments available to us. So I want to stop and ask a question. What percentage of strokes can be prevented? Is it none, 80%, 20%, or 100%? Great, correct. It's 80%. And again, this is our first line defense against stroke. Is the first thing we can do is actually prevent it from happening. And we can look forward into 2030, and we're anticipating that strokes are going to increase and also possibly double in certain populations. So this is a big opportunity for us to do better in our lifestyles. All right, let me get back. There we go. I am going to move something here. All right. So what is a stroke? We haven't defined that yet. So a stroke occurs when one of the blood vessels that carry blood to the brain is either blocked or it bursts. And the part of the brain that does not get the blood it needs causes brain cells to die. And this happens immediately, so time is very important. So we want everybody to understand that stroke is an emergency and we need to act fast and call 911 immediately. So there is more than one type of stroke. The most common type of stroke is an ischemic stroke. And an ischemic stroke occurs when the arteries are blocked by a blood clot or by the gradual buildup of plaque or other fatty deposits, which cause the inner lumen or the inside opening of that blood vessel to become smaller and tighter. And then eventually they can become blocked by a blood clot. 87% of strokes are ischemic strokes. And so we tend to focus a lot of our treatments around this area, although we can have a stroke that is caused from the blood vessel when it breaks. And this leads to bleeding into the brain. And we call these hemorrhagic strokes. And this is 13% of strokes are hemorrhagic strokes. And these are associated with a higher risk of death than ischemic strokes are. So again, we take them all very seriously. And we can provide treatments, whether it's caused from a blockage, your ischemic stroke, or from bleeding, the hemorrhagic stroke. So we've talked a little bit about FAST. We've mentioned that we want to recognize stroke fast, but why learn this? Well, if we recognize stroke fast, it can help us save lives. It's also easy to remember. We can, when we're panicking or something is happening, then we can always remember I need to act fast. It's also very easy to teach to individuals across the spectrum. So from young to older, it's something that's very easy to teach. And it reminds us that this requires quick action. So when we look at FAST, we're going to look a little bit more into what FAST means. So F is for face drooping. So the first thing we're going to look for is, does one side of the face droop or is it numb? You can ask the person to smile and show their teeth and look to see if that person's smile is either uneven or lopsided. A is for arm weakness. So we're looking if one arm is weak or numb. So you have changes in the arm. You can ask the individual to raise both arms up, and if one arm drifts down, then you know that that side is weaker. S is for speech. And so we're asking, is the speech slurred? Is that person unable to speak or maybe difficult to understand? Perhaps their speech is garbled or the words that they're saying don't make sense. And so you can ask that person to repeat a sentence. The sky is blue. Anything that you can think of. And then you know that it's time to call 911. If the person shows any one of these symptoms, so it doesn't have to be all of them, any one, then the likelihood of them having a stroke is great, and we want to call 911 and get them to the hospital immediately. Now, it's also very important to know that even if the symptoms go away, you still want to take this action. Oftentimes, if the symptoms go away, they could very well come back. It could be an indicator that a larger stroke with permanent damage is going to occur imminently in the future. So there are also some other symptoms of stroke that I don't want us to forget. And so we kind of call these the suddens. And so that's a big hallmark of stroke. If somebody was okay 1 minute and then the next minute they're not okay, then that is very characteristic of how stroke happens. Now, it can happen gradually for sure, but it's very common to have a sudden change in that patient's condition or that person's condition. So if the individual has sudden numbness or weakness, this could be of the face, it could be the arm, it could be the leg, and especially if it's on one side of the body. If there is sudden confusion or sudden trouble speaking or understanding speech, so we're looking back at that speech component again. Is their speech slurred? Especially if they're normally very clear in their speech and then something happens to it. Are they unable to speak or hard to understand? They're just not making sense. And again, you want to go back to asking them to repeat something very simple. The sky is blue. If they have sudden trouble seeing in one or both eyes. So sometimes people may notice that suddenly their vision became blurry. Maybe they were watching television and they suddenly were not able to see as well. This is oftentimes a missed sign of stroke, but if you do have sudden onset of vision or being able to see, then that can be an indicator that you're having a stroke that is affecting this back part of your brain. And then if you're having sudden trouble walking, You know, if somebody is walking through a door and you notice they're kind of bumping into the door jamb, that could be a vision issue. Maybe they're really not able to see their periphery very well, or it could be that they're dizzy or having a loss of balance. This also is a commonly missed sign of stroke when we have this imbalance or dizziness that people have. So when we're talking about acting fast, it's very important that if you or someone experiences one or more of these symptoms, even for a short time, you want to call 911 and get that individual to the hospital. The hospitals do a lot of engagement with our 911 providers, and so they are very well versed at identifying stroke out in the field when they respond to 911 calls, and they also know the correct hospitals to take these patients to. We want to take stroke patients to stroke hospitals that specialize in the care of stroke patients. So we have medical options that reduce the effects of stroke, and time is extremely important because these treatments are often time sensitive and must be administered soon after the onset of any stroke symptoms. So stroke can strike fast. Remember, sudden onset, remembering our face, arm, speech, and time. And we want you to act fast as well. The quicker we act and the quicker we treat, the more brain cells that we can save, and then that can lead to less disability and increased chance of survival. So I'll ask you a question. What acronym helps us recognize stroke? Oh, let me go back up. We'll give everybody a chance to answer that. So what acronyms helps you recognize a stroke fast when it happens? Right, I gave the answer. Right, so perfect, so FAST. So we want to remember face, arm, speech, and then that is time to call 911 without delay. Great. So I do want to talk a little bit about transient ischemic attack. This is an episode that's sometimes called a mini stroke. Symptoms can be temporary and they may come or go, and it generally does not cause permanent brain damage. Although it is a very serious warning sign of stroke and should not be ignored, as oftentimes that is a warning sign, and you can, within a week, 30 days, you can end up having a serious stroke if we don't address what is going on to cause these transient stroke symptoms. So the symptoms of a TIA and stroke are basically the same. It's just that those symptoms may go away. And so that's why we say if you recognize any of the stroke symptoms, even if they go away, you want to seek medical treatment in the event that they come back quickly. And then also maybe we have a perfect opportunity to actually prevent an actual stroke with brain damage from occurring. All right, so let's talk a little bit about the effects of stroke. The effects of stroke depend on various factors. So the region of the brain that is affected, as I mentioned, the backside of the brain, we may have some dizziness or some visual disturbances. Depending upon what side of the brain is affected, you may have issues with your ability to produce speech or understand speech when it's coming back in. So it's really individualized to where the brain damage is and how that is going to affect that person. The size of the area that was damaged by the stroke is definitely going to impact the actual effect of stroke. And then the functions that are damaged. Is it an area that controls you moving your arm or an area that controls you moving your leg? And so those are all going to impact how the stroke is going to affect the individual. So stroke does not look the same for everyone. So I'm going to ask you another question. Why is timing so important when responding to and treating stroke? So does it improve outcomes? Treatments are time sensitive, it saves lives, or all of the above? Great, so it definitely saves lives. Also, treatments are time sensitive and it does improve outcomes. So the faster we act, we'll be able to meet all of our goals. We want to improve patients' outcomes. We want to be able to provide everybody that arrives to the hospitals with treatments that are time sensitive. So the longer you wait to arrive, then sometimes some of those treatments may become unavailable to you. And ultimately, our number one goal is we want to save lives, even if it's actual, and it may just be the quality of life that we're trying to save, so you can survive without disability. All right, so some risk factors cannot be controlled, and we'll talk about what are those things that we can do to prevent a stroke from happening. But there are some things that are just risk factors that we have, and that should increase our awareness that we really need to focus on other things that we can control. So age, strokes can occur at any age. However, your risk does increase over the age of 55. Family history, there does appear to be some genetic link. So if you have an individual in your family that has had a stroke, your increase of stroke then is going to be greater than somebody who doesn't have that in their family history. So you are at a higher risk if an immediate family member has had a stroke. And then race and ethnicity. So we talked about African Americans. We are a large Hispanic community here, specifically in San Antonio and surrounding areas. And Hispanics also have a higher risk of stroke than Caucasian or white counterparts. We touched a little bit on gender. Women have a lower risk than men before menopause. However, remember, as we get older, our risk then does increase. And so women do actually have more strokes than men over our entire lifespan, and more women than men die of stroke. We also talked about TIA. So if you have either a prior stroke or a transient ischemic attack, TIA in your history, then you are at a greater risk for a stroke to occur. So a person who has had one or more TIAs is almost 10 times more likely to have a stroke than someone of the same age and gender who has not. So those TIAs are warning signs, and they're opportunities for us to prevent the stroke from happening. If you have actually had a stroke, then you're at greater risk for another stroke, and almost 1 in 4 will experience a recurrent stroke if we do not manage your controlled risk factors, things that we can actually change. So medical risk factors that we have an opportunity to control or intervene. High blood pressure. High blood pressure is actually the number one cause of strokes, whether it be one that is caused by an ischemic stroke with that blocked blood vessel, or if it's one that is a hemorrhagic stroke where the blood vessel bursts. So our goal blood pressure is less than 130/80, and above that is considered high blood pressure. And over time, it takes its toll on the inner lumen, or the inner portion of our blood vessels, and those can become damaged over time and then lead to blood clots or actually burst from pressure over time. Diabetes is also a medical risk factor. Having diabetes more than doubles your risk of stroke. So it's very important that you identify and then manage so that you can control your diabetes. So high blood glucose increases plaque buildup in the arteries. And again, it leads to those clots that can flow downstream and block blood flow. And then also cholesterol. So you don't want to have buildup of fatty deposits in your artery walls. So we talk about knowing your ABCs. So if you know your hemoglobin A1C, that lets you know how well are you controlling your diabetes, or are you at risk for diabetes. B is for blood pressure. We do encourage home monitoring of blood pressure. It's kind of a silent killer. If you're not actually measuring it, you can't always tell if your blood pressure is high or low. And then C is for cholesterol. You definitely want to have those annual visits with your medical physicians so that you can have your cholesterol levels checked and see if you need to be treated for hypercholesterolemia. Other risk factors are circulation problems. Strokes can be caused by blockages in your arteries and veins that carry blood through to your heart, or through your heart to your brain. So you would want to look to see if anybody has any vascular issues in their legs. We always look to see if anybody has any vascular issues in their neck, because those are areas where blood clots can break loose and then travel and then make it up to your brain. Atrial fib, atrial fibrillation, which we refer to as AFib, or atrial flutter, is an abnormal heart rhythm. So instead of having a nice synchronized beating of your heart, the top part of your heart kind of quivers, and that allows for blood to swirl and coagulate, and can then form clots because the blood isn't moving very well. What we do know about atrial fib or atrial flutter is it increases your stroke risk fivefold. So that means you're at 5 times greater the risk of having a stroke if you do have this particular heart rhythm. So it's very important, again, that you keep your annual visits with your doctors. They will be looking at your heart rate and blood pressure and all of your lab levels, and then you can get treated to decrease any clot formation. So the atrial fib or atrial flutter are often treated with anticoagulants to keep your blood thin, so blood thinners. So which medical conditions should be treated in order to reduce your risk of stroke? So atrial fibrillation and circulatory problems, age, family history, race, and ethnicity, high blood pressure, diabetes, and cholesterol, or both A and C. Correct. So we can treat atrial fibrillation and circulatory problems in order to decrease your risk of stroke. And then we can also manage our risk factors, such which are medical risk factors, high blood pressure, diabetes, and cholesterol, to decrease our risk for stroke. All right, so some other things that we can do, definitely quit smoking or using tobacco. So people who do smoke have a 2 to 4 time increased risk of having a stroke compared to someone who hasn't had a stroke, or compared to people who don't smoke. And then those who have quit smoking more than 10 years ago, also that will lower your risk of stroke. And this does include all tobacco, including e-cigarettes. So we do not encourage the use of that either. Also, you can modify your lifestyle by eliminating or reducing alcohol use. So heavy drinking can increase your risk for stroke, and the recommendation is no more than 2 drinks a day for men and no more than 1 drink a day for non-pregnant women. Increase in physical activity, which has been challenging with the quarantine and the freeze and all this, but physical activity can help reduce stroke. So we encourage a brisk 30-minute walk each day to improve your daily health, and that's just 15 minutes each way. So 15 minutes, and then once you get to 15 minutes, you can turn around and come back. And then that can significantly decrease your risk for stroke. And it also helps you maintain a healthy weight. Obesity and excessive weight can put a strain on your entire circulatory system. And most of this is going to be tied to physical activity and eating a healthy diet. And then there are other things that you will need to seek help from your medical professionals as well. So eating a healthy diet, one that's rich in fresh fruit and vegetables. You want to limit your salt intake, avoid fried foods, and avoid snacking. And all of these things, although they focus at decreasing your risk factor for stroke, they also decrease your risk factors for heart attack as well. So a heart healthy diet is a stroke healthy diet as well. So what types of small changes can you implement in your life to reduce your risk for primary or secondary strokes? So quit smoking and reduce alcohol consumption, increase physical activity, eat a healthy diet, and maintain a healthy weight, stop taking medications as prescribed. So great. So it's both A and B. We want to quit smoking if you do smoke and reduce your alcohol consumption, and then increasing physical activity, eating that healthy diet, and then maintaining a healthy weight. And we always say that it's important to keep all of your scheduled medical visits and to continue taking your medications as prescribed. Great. So it's important then that we think and act fast in order to save a life. We want to call 911 immediately if we identify any one of the fast symptoms, or if you see a sudden change in somebody. And we do that because we want to improve survival and also recovery. So why do we want to teach fast? We'll just go back to that right quick. By teaching fast, it not only allows individuals in the community to act fast, but it allows the medical team to act fast as well. And so our goal is to be very rapid in our treatment when you reach the hospital. And so by using 911, they will communicate with the hospital, and then we can quickly do some brain imaging and determine what type of stroke you're having. If you're diagnosed with a stroke, then we'll determine the most appropriate treatment. And remember, some of these treatments are very time sensitive. So we'll be looking at when was the last time that you were known well without stroke symptoms, because certain medication can only be given shortly after the onset of stroke. So I'll end there. There is a lot of other information out there. We have our strokeassociation.org. There's strokeawareness.com, and there's also stroke.org. And also our Baptist Health System site offers some information about stroke as well. So I'll stop there and open up for any questions or comments.
Great. Well, thank you, Michelle, for sharing that information with us. Audience members, if you do have a question for Michelle, please do submit it through the chat box or the Q&A box. I will go ahead and kick it off. And I know we kind of went through a lot of the information about stroke, but just to recap, Michelle, what are some of the symptoms of stroke, just to refresh our memories with that?
Right. So symptoms of stroke, the big things that we always want to remember is that acronym for FAST. So facial droop, arm weakness on one side of the body, and then any speech abnormality. Any one of those symptoms can mean that the individual is having a stroke. And then we have our sudden onset. So we like to think about sudden onset of a loss of balance or sudden onset of any eye or visual disturbances. So you can actually turn your FAST into B.E.F.A.S.T, looking for balance, eyes, and then F for facial droop, arm for arm weakness, and S for speech. And then most importantly, time to call 911.
Excellent. Thank you for that refresher. We do have a question from one of our attendees. The question is, on an 80-year-old female, how can we tell the difference between a stroke and a seizure?
All right. That is actually a really excellent question. And one of the reasons why we tell you to look for the fast symptoms and also to look for the sudden symptoms is that may help you identify that there is something acutely going on with your family member or loved one or coworker. And so that's why we like you to call 911. We are really not going to know 100% if you're having a stroke versus a seizure. Maybe you're not waking up or you've become unresponsive because of seizure until we actually get you in and do the brain imaging. Even the 911 provider is going to go by the FAST screen along with the B.E.F.A.S.T screen in order to determine if it's likely that you're having a stroke. Once we bring you into the hospital and we can do some brain imaging, we can very quickly rule out if it's a bleeding stroke or not. And then we can look for further evaluation to determine if we think that this is in fact a stroke that's being caused by a blockage. So it's sometimes hard to tell when you first see it. And that is why you want to come in and allow us to do some of our advanced imaging. Also with a seizure, you usually kind of have that post-ictal state where you may be unresponsive or not responding as well. And then that will usually pass. And so again, then we would look at what other risk factors do you have for us to manage, looking at the brain imaging, and it may take up to 24 hours before we're able to confirm that you have definitely not had a stroke versus a seizure. I'll say the same thing as for migraine. Sometimes people have difficulty. How do I know if I'm having a migraine? How do I know if I'm having a stroke? And you won't always be able to know that for sure. So if you see any of the concerning symptoms, the most safest action is to call 911 and come into the hospital and allow for that medical evaluation to take place.
Wonderful. That was a great question. Thank you for that. Okay, it seems like we do have another question. Somebody has typed in, I heard recently sitting is the new smoking related to COVID working from home. Can you speak to new recommendations for sitting while working?
Right. Well, that's excellent. I have not seen anything new really that's come out. I do know that we're encouraging that you have at least 30 to 45 minutes of daily exercise each day. And those of us that have engaged into technology, especially with the Apple Watches, they tell you to get up and move every hour. So, the thought is that if you get up and move a couple of minutes every hour, as opposed to sitting idle over a long period of time, will decrease your risk for stroke. We also think about that, if you were on a long airplane ride, it's the same thing, right? You're sitting still for a very long time, and that can lead to some clot development down in the legs. And then those clots could always potentially break loose, make its way through the heart, and then up to the brain. So, although the American Heart Association or the American Stroke Association has not put anything out, I would say you want to get up and move around a couple of minutes each hour of the day. And then also make sure that you're getting that physical activity.
Okay, great. There is a comment from the question earlier about the difference between stroke and seizures. The comment is, thank you for mentioning migraines and similar symptoms.
Mhm.
That has been my experience.
Yeah. And
Um,
I think too, just females and migraines, especially, we see a lot of individuals who come in and their symptoms are mimicking a stroke, and it ends up being a migraine. But since the treatments are so time sensitive, it's hard for us, especially when we're at our homes or out at the store or just living our daily lives, to really determine what this emergency is. So it's just important that we focus on this is an emergency, and then get treated and then figure out how to manage it better.
Great. So there is another question here. The question states, I regularly sit with one leg or the other tucked up underneath me. Related to circulation, is this any real risk factor?
I don't think that sitting cross-legged or crossing your legs is identified as a risk factor per se. I think we're at more risk if we're just staying in one position for prolonged periods of time. So again, getting up, moving around, stretching your legs, allowing yourself to stand up and move around, I think is where we can significantly decrease our risk. There's no actual clinical practice guidelines or research that I have seen that says don't cross your legs or that's bad for you. Now, if you have known circulation problems in your legs, your physicians may instruct you that maybe it's better if you don't do that, and then definitely go back to focusing on getting up and moving around frequently and not sitting idle for prolonged periods of time.
Okay, great. Michelle, I do have a question that I'd like to ask and may be helpful to the group. So right now we're still in the middle of the COVID pandemic, and I know that there are a lot of people who are concerned about going to the hospital to receive treatment. So I know you talked about the importance of timing and how it's important to call 911, but can you share with us, even during this COVID pandemic and all the concerns about safety, why is it still important for a patient to come into the hospital for treatment?
Mhm. It's very important, and time is still of the essence. So recognizing stroke is still going to be the same. With COVID, it has offered some challenges in that sometimes COVID-19 actually can increase the risk of having a stroke. So we have recognized that. One of the challenges that we have had throughout the pandemic is people delaying arrival to the hospital, and then that will lead to our inability to provide some of these time sensitive treatments. I go to the hospital every day and then I'm out in the community every day. And actually, the hospital is probably one of the safe places that you can be at. We're doing a lot of screening. We're intaking our patients differently into the emergency room so that we can screen and keep everybody safe. So we have gone through great lengths to basically keep all of our patients very safe. We're now actually able to do some rapid testing as well, so that we can make sure that we keep patients and our staff safe. So, and we started that very early on with doing a lot of screening and then keeping certain symptoms separate from others, and just basically trying to keep everybody safe. But I think the hospital is safer than going to the grocery store or going to the mall or anywhere out there, because we're all doing the mitigation efforts collectively as a team to keep our patients safe when they do come into the hospital.
Great. Thank you for talking about that. I just wanted to let our attendees know that we are taking the precautions so that they can come in and receive the care that they need and not delay care.
Yes,
Um,
and I think just not delaying the care is just very important. I think initially, when we started dealing with the pandemic, we did notice that a lot of our stroke patients presented to the hospital later after their stroke symptoms started. And so we did lose the ability to provide some of the time sensitive treatments. I think that's gotten better as we've all adjusted to life with the pandemic. And again, the hospital, we have daily conversations every day to kind of know what is going on out in the community. And we have a lot of mitigation efforts that go on at the hospital. So whether it is a heart attack, whether it is a stroke attack, if it's any emergency, your 911 providers and your hospital providers are going to take safe care of you.
Wonderful, Michelle. Thank you. There is a comment or question in here. My father-in-law had a stroke over 5 years ago and still experiences speech-related problems when he gets anxious. Is this normal, or should symptoms go away after a certain amount of time?
All right. Well, I'm going to say that that is actually normal. We do not expect that someone will have complete resolution of symptoms after a stroke. It's always our hope and our goal to be able to return someone to their exact same condition that they were prior to having a stroke. And that is where time is so important when we are treating strokes, because a certain part of your brain when you begin to have that stroke will die, and the part of the brain that dies will never come back to life. And so if it has affected part of the speech control, then that issue will always be there. Now, I'll also say that with a caveat that our brain is really an amazing organ, and it does kind of figure out how to work around those damaged areas. And so with ongoing therapy, people are able to have improvement year over year after year, or time after time after time. So your recovery really never ends. You may have some initial big recovery in that first year, but it doesn't stop after that. So the fact that he still has that speech disability, especially that comes up when he's stressed or if he's tired, is actually quite normal that would be there. But I would also just continue to work on that so that it can continue to improve over time.
Awesome. Thank you for answering that. And I actually did want to, ask if you could share with our audience a little bit. I did talk in our introduction about some of these services that we offer, but it was more related to if somebody is impacted by stroke, is there a hope that somebody can recover? Can we maybe talk a little bit about the additional services, the rehabilitation services and stroke support groups that we offer as well to help a patient go through their recovery process?
Absolutely. Yeah. So, we kind of think of things as a chain of survival. So, our first opportunity is to prevent it. The next is to recognize it fast, then treat it fast. And then the next step is recovery. And we begin to focus on recovery immediately. So, as soon as we have identified that someone's having a stroke and we do all of our fast treatment options, the next thing that we do is we bring in our rehabilitative team into the care of the patient. So within 24 hours after having a stroke and being admitted to the hospital, we have evaluations from speech therapy, physical therapy, occupational therapy, so we can identify where your deficits or disabilities are as a result of the stroke, so that we can immediately begin to work on that. And again, the more we work on those things, it's like exercising. If you keep lifting weights, with that arm, that muscle is going to get bigger. And so it's the same thing with the brain. If we identify where the issues are and we begin to work on speech over and over again, or learning and problem solving, or getting up and walking, or recovering, how do I dress myself and brush my teeth, that repetition is going to help the brain regenerate those pathways. so that you can recover from those areas and once again get back to either the state before the stroke or at least to a point of independence. So we start that immediately upon admission to the hospital. And then we rely heavily on our rehabilitative staff to help us determine what is the next level of care along with our rehab physicians. So is it going home with some home health, or do we then bring you into our inpatient rehabilitative services? So we do have inpatient rehab. I actually encourage most people, if you have the opportunity to do some inpatient rehab after having a stroke or a surgery or any reason why you're in the hospital, that is an excellent way to get back on your feet, to make additional rapid recovery. And then most importantly, make sure that when you go home that you are prepared to be able to take care of yourself. I really think that, for us, we focus on all of the hospital component, but I think it becomes very real where the struggle is. And that is when you actually return home and you try to get back into your daily life. And I think that's where beginning rehab in the hospital and then visiting one of our inpatient rehab centers can make a world of difference so that you can feel comfortable and confident once you go home. Even if you continue some home health at home and then transition to, we also have outpatient therapy where you can go in and continue to have therapy with speech, occupational, or physical therapy. And so I think that that is probably one of the most important things that we do after you've already had the stroke is getting you back to living your life. And there's definitely life after stroke. So that's why we want to kind of try to, number one, prevent it, treat it quickly, and then focus on recovery with our rehab services.
Thank you for that, Michelle. That was great. We do have a question, and the question is, if I think I'm having a stroke, what is the most important information I can give to 911 or the EMTs?
All right. Well, that is excellent. And thank you for asking that. So, the most important thing that you can tell the healthcare providers, your 911 provider, your emergency room physician, and nurse, is the time that you were last known well. So if, we're sitting here talking, it's 11:46, and then somebody notices that you speak to me at noon and I do not seem to be my normal self, then you would know that the last time you talked to me and I was normal was at 11:46, because that's where your treatment clock starts. So we need to very quickly determine how long these stroke symptoms have been going on. It's very important too. Everybody may go to bed at 9 o'clock at night, and that's the last time that you speak to me. And then now it's 9 o'clock in the morning and I'm not okay. The last time that you knew I was normal was at 9 p.m. when I went to bed. Sometimes people may remember I heard my husband or my wife get up and go to the bathroom at 2 in the morning and they seemed to be fine then we can use that time last known well as a marker, so then we can know what treatment you're going to be eligible for.
Okay, great. And just a reminder to our participants, we still have a few more minutes remaining. If you would like to ask a question for Michelle, you can type your question into the Q&A box or into the chat box. Michelle, I do have a question that I wanted to ask you. I know we talked a little bit earlier in our intro again about what, St. Luke's having the Comprehensive Stroke Center, but we know that there's other facilities in San Antonio that offer different levels of stroke care, such as primary. Can you tell us a little bit about what the differences between those facilities and what that means?
Yes. So we're very fortunate here in San Antonio in that we have probably about 13 to 15 different stroke centers that can provide care to stroke. And the difference is, as you say, with the different levels of certifications that they have. So an acute stroke ready hospital is going to be, I think we have a freestanding ED, I think maybe a Christus facility, but an acute stroke ready hospital means that they're going to recognize stroke and they have the ability to give you the clot busting medication, and then they're going to transfer you to a higher level of care for the rest of the care that you may need to take care of you after stroke. A primary stroke center is going to be able to identify that you've had a stroke, give you the clot busting medication. They can determine if you may qualify for the clot removal treatment. And then they can also admit you to their hospital and provide stroke care that meets certain standards to make sure that you have the best outcomes. If a primary care facility determines that you do need a large clot removal treatment, then they will transfer you to a comprehensive center. So a comprehensive center can basically take care of everything. So they can recognize that you're having a stroke. They can give you the clot busting medication if it's due to a clot. They can give you the blood thinning reversal medication if that's what you need. If they identify that you have a large vessel occlusion or a large blood clot that we can remove, a comprehensive center can provide that level of treatment for you at that time. And then also a high level of care then will be provided once you're admitted to the hospital, whether you're in the intensive care unit or in a step down or a stroke unit. So it's just kind of different levels of care that we can provide, and each one provides a higher level of care and has more resources available to provide that care. One thing that we do know is that your outcomes and survival are going to be much better if you are presented to and provided care for at a stroke center. And then for those advanced interventions, then that's where you really need the team that are at these comprehensive stroke centers.
Excellent. Thank you so much for sharing that. We do have a few more minutes, and if you would like to ask a question, please submit your question through the Q&A or through the chat box. Just give you guys a minute. Okay, I am not seeing any additional questions coming through, so we will go ahead and begin to wrap up. So thank you again, Michele, for spending some time with us and answering questions about stroke. Attendees, thank you for spending some time with us and learning more about what stroke is, what the signs and symptoms are, and the interventions that are available for treatment. We do hope that you will continue to follow Baptist Health System, and we look forward to seeing you at future events. This does conclude our seminar today, and we wish you all a great afternoon.